Yes, so welcome to this press conference after the virtual EPSCO meeting this morning with a focus on the WHO reform. We are joined virtually by Health Minister Jens Spahn in Berlin and Commissioner Kiriakidis in Brussels. Welcome. Just a short note in terms of housekeeping, just a quick reminder for everyone to please turn off your microphones when you're not speaking. As I just mentioned, we have translation available in English, French, and German. So thank you very much to the interpreters that are making this possible, so everyone can listen to it in their own language. I now hand over to Minister Jens Spahn. Sie haben das Wort, Herr Spahn.
Ja, vielen Dank. Thank you very much indeed, meine Damen und Herren.
Ladies and gentlemen, even though it's not surprising, I'm in a rather unusual situation. I'm in quarantine. So I headed the council, I chaired it from home, and I think things went quite smoothly. The interpreter apologizes. There are lots of fluctuations in the sound, which is making it hard to hear. But regardless of the fact that I myself am affected by the pandemic, it is a challenge for us as private individuals, as communities, but as ministers and as the European Union as well. It's a huge challenge, and we know that we can't overcome it alone. We can only overcome it together within the European Union. So what it calls for is understanding and acceptance.
Wir sind diesem Virus nicht machtlos ausgeliefert.
We're not powerless in the face of it. After all, there are hygiene measures and masks. We can wear masks, but we need to coordinate strategies with other member states, and that came across very clearly. But it's important that people take charge of their own responsibilities on a daily basis. So I'm very grateful for the show of solidarity and cohesion among health ministers, colleagues within the European Union. I'm very glad to see evidence of that once again. Yesterday there was a meeting of the heads of state or government who had an exchange of views, and we had a meeting today, and that sends out a strong signal. I'm afraid the sound is very difficult to hear. We're just having to pick out bits and pieces of it. So I think that this shows that it is a real challenge, but the consequence ensuing from that simple truth is not easy. It calls for constant resilience and readiness to coordinate and to make compromises as well. We need to agree, for example, what the implications are for travel. That includes travel within Europe. And what about distribution of vaccines and the like? At the beginning of the pandemic, we learned that in Europe, we need to stand together as Europe, because without solidarity, there is no Europe. The Commission, dear Stella, has also submitted proposals for overcoming the crisis, and we were keen to discuss those on behalf of the German presidency as well. And we had a first discussion of those, and it calls upon member states to make the Corona Alert apps interoperable, and we're very grateful that we've been able to make a start on that. There are some European countries which have interoperable Corona Alert style apps with the support of the Commission. We've already done that, a number have, and others will be following suit. And there's a similar idea behind the need for to package and bundle vaccine provision and to see how we can coordinate. Once a vaccine has been authorized, then we need to continue to coordinate, not least in order to ensure an increase in acceptance, because it's all about distribution and monitoring within the European Union as well, and cooperation is vital for that. We need to monitor vaccination strategies, and we very much welcome the proposal for coordination of these strategies. So we welcome the proposals tabled by the Commission and its institutions, and the contribution that we've been able to make to that. We need to strike a balance, after all, between national competencies and European competencies, and we need to draw upon support and expertise in all quarters. Everyone within the European Union very much appreciates that. I'm grateful that today we were able to reach a common understanding as to how in the European Union we should accompany the forthcoming WHO reforms, we need to play an important part in that. We want to ensure that the WHO is more transparent, more effective, and has more clout. And there's one thing which is very important as part of that. The WHO can only be as good as we allow it to be. All of us working on behalf of international organizations, we can all only be as good as the way in which we shape the organizations and the funding which we provide for them as well. We discussed that idea as well, the idea of compulsory contributions being paid, so that ultimately the discussion of the idea of private funding of the WHO can be countered in that it will only work if there is sufficient willingness on the part of the WHO member states to provide funding for it. It's important that information is made available, and here too, as we've seen in the course of the pandemic, here again, an international institution can only be as good as the information that it gets from the member states, and that applies specifically in respect of the ECDC as well. It can only be as good as we allow it to be, we enable it to be, by providing it with all the relevant information that we have available. And that also applies in respect of governance of the WHO, for example, in terms of the interplay between the headquarters in Geneva and the various WHO bodies elsewhere. That's part of the day-to-day interplay between those bodies, and the emergency mechanisms as well. We were interested in all these issues, and we discussed them among the member states, and for the first time we have a common position on behalf of all 27 regarding the reform process of the WHO. And now, after the formal vote on that, we intend to table that and raise it on the 9th of November at the WHO General Assembly as an EU position, so that we can pull together to campaign worldwide to ensure that the reform process can be taken forward, working with the European Union, but with other parts of the world as well. The German presidency feels that the meeting of health ministers today sends out a very important signal in respect of the challenges facing us regarding the pandemic and the fact that we need to overcome them together. Thank you very much, Mr. Spahn.
For my oversight, there's also a translation into Italian, Spanish, and Dutch for you available. I now hand over to Commissioner for Health and Food Safety, Stella Kiriakidis. Commissioner, we cannot hear you. Now it should work. I see your microphone. No. I think our technical colleagues are getting in touch with your colleagues.
Excuse me, Commissioner Kiriakidis, can you speak? Because you are unmuted. Okay, can you say something? Okay. No, you are unmuted on a Zoom conference, but we cannot hear you.
May I suggest that while we give the Commissioner a few minutes, maybe we just take the first question. Yeah, is that okay for you, Commissioner? Then I might take the first question while the Commissioner and her team are looking into the situation. And I see that there's a question from Francesco Guarascio from Reuters.
can you hear me?
Hello, yes, can you hear me? Sorry, I was, can you hear me?
Yes, Francesco, we can hear you.
Hello? Yeah, sorry. So my question is also for both Minister Spahn and for Commissioner Kiriakidis. I hope she can hear me. I have two questions. The first on the WHO reform. So now you have a common position among EU states. So what's the next step? You will present this common position at the WHO Assembly in mid-November, but when do you expect the WHO reform process to begin, and when should it be concluded? And also, have you discussed your proposals with other WHO countries like China? So this is the first question. The second question is about for both is about the pandemic in Europe. Germany has announced a partial lockdown this week. Would you advise other EU states to introduce lockdowns or partial lockdowns as soon as possible to limit the spread of the pandemic?
Thank you, Francesco. I will hand over to Minister Spahn.
Ja, vielen Dank. Thank you very much.
Thank you very much.
Zum einen zur WHO-Reform.
First of all, on the WHO reform, of course, we do want a common position.
Allies all over the world. Und das zum Beispiel.
For example, within the G7, we want to find allies. We have Germany, Italy, and France, who will be campaigning for support to our position within the G7. And we have members of the European Union on the executive board of the WHO who can advocate our position as well. So to sum up, basically what that means is that, of course, we want to find many partners worldwide who will work together with us to take forward WHO reforms. And it's vital that we make a start now. I don't think there's anything to be said for the idea that we'll wait until the pandemic is over and only then set a process in motion. And then that perhaps at some stage we will decide to do something. No, there's a real acute need further to in the light of the current pandemic. And so I think that in parallel with that, we need to have the WHO reform debate taking place. As it already begun in May, it will now be continued in November. And as the EU, and on behalf of the German government as well, I can say that as Germany, we will also be active drivers of this process. And we will be sparing no efforts in that regard. And after all, it is really important that we have an opportunity to discuss with other people, other countries in the world as well, and advocating our approach. Now, as regards the situation in Europe in respect of the pandemic, well, in Germany, as you know, this week we did take a decision to implement measures which are intended first and foremost to ensure that schools, nursery schools, and economic life industry as far as possible can continue to operate. But at the same time, that means that there are other areas where we need to cut back on contact significantly. And we can only the virus is only spread when contacts take place after all. And I myself have experienced the need to implement the rules involving reducing contacts, hygiene, and wearing masks. But you can't get the risk down to zero. But in view of the rapid developments taking place in the whole of Europe, in almost all European countries, they're taking measures to reduce contacts. And we want to try to keep schools and nursery schools open and to keep the economy running as far as possible as well, to keep industry going. But that means that in other areas, we have to cut back on contacts in our private lives and in terms of our leisure activities, the hospitality industry. And all in all, we want to try to get things under control again, get a grip on things again. And my impression is that all other European countries are taking action along very similar lines, albeit in different situations in some instances. The situation in some European countries, at least in terms of the numbers, the figures, is far more dramatic than it is in other countries, which means that an appropriate response needs to be forthcoming when it comes to reducing contacts in order to reduce the spread of the virus.
Dank, Herr Spahn. I will try again with Commissioner Kyriakides. Can you...
Do I have sound now?
Yes, we can hear you.
I apologize about that. This is technical difficulties. I'll immediately come to the questions, and if after the questions then you would allow me to give my introductory statements, that would be a great help.
Of course.
First of all, in terms of the question on WHO, Minister Spahn has already answered a great deal of that. What I would say is that the Commission is already one of the major funders of WHO, and I think that this is extremely important. For us at the moment, what is important to highlight is that we need to work with all international organizations globally when dealing with the pandemic. This has become even more evident over the last few months, and it is only by strengthening these organizations that we can move and be more effective together. So we have, as EU institutions in 2019, provided over 101 million to WHO, and we are together with Germany and others, we are funding it, one of the third highest funders of it. So for ourselves, it's extremely important that we move ahead with these reforms with WHO in order to be able to face the current situation. Now, in terms of the epidemiological situation in the recent weeks, we have seen a steady number of increase of cases across the member states in the last few weeks. We have seen a steady number of the increase of hospitalizations and sadly also an increase in the mortality. This, of course, is a highly concerning situation for us, and we are at the moment working very closely with member states in order to improve and further improve cooperation and coordination with the European Centre of Disease Prevention and Control. Minister Spahn has already shared with you that in order for us to be effective, we need to have information sharing, we need to have data shared with ECDC so we can be effective. There is a real risk now that health systems will be overwhelmed with the increasing number of cases, and we are working at the European level to ensure that there is as close as possible collaboration and solidarity in order to be able to face the current situation. Thank you.
Thank you very much, Commissioner. Just a quick reminder to the journalists to please use the raise hand function if you have a question so that we can see it here. I see there's a question from Nikos from Bloomberg. Nikos?
Yes, can you hear me?
Yes.
Yes. So, Commissioner, you said that there is a real risk that some health systems will be overwhelmed. I was wondering how many ministers briefed you today at the call that their health systems are near collapse, hitting maximum ICU capacity. How soon do they expect this to happen? And whether do you discuss a backup plan for the transfer of patients and what you will do in the case where a health system gets overwhelmed and it cannot really offer appropriate health treatment?
Thank you for that question, Nikos. Of course, this was not discussed in detail of the call today, but one that I would say is that we have been supporting member states since the last first wave of this pandemic to be ready for this situation, and they are much more ready than they were then. We have launched joint procurement procedures to allow them to procure key protective equipment and medical equipment, including ventilators. We have joint procurement frameworks, which we launched in October with Gilead for remdesivir. We have mobilized 100 million euro from the emergency support instrument for MESI, and we are calling on member states to use the Commission's early warnings and response system to organize cross-border transport of patients and offer for hospital beds. What is extremely important to understand, and I will also add here that we're now working towards collecting information from member states to be given to us, to ECDC, on their ICU capacities, because unless we have information, we're not able to act. But what I think it is important here is to understand that we are able, through the measures that are being put in place and through communicating with citizens of their role, their proactive role in adhering to these measures, that we are able to, as we have before, control the numbers of this pandemic, and in this way lessen the burden on the health systems. But it is important that we understand that this is a joint effort and that citizens have a very active part to play. Thank you.
If I might just shortly comment or add something, because of course Germany right now is in still the lucky position to take patients for ICU treatment from our neighboring countries. That makes us, first of all, humble and grateful that we are lucky enough to support our neighbors. And so far we have taken patients to the Netherlands. Of course, we will help Belgium and the Czech Republic. And we will help all our neighbors as soon as they ask for support. We will support by taking patients into our ICU capacities as long as we can. And for now, for today, I can say we still can.
Thank you both. There's another question from Carlo Matuscelli from Politico.
Yes, hello. Thank you for taking my question. My first one is for Minister Spahn, and it's, is it appropriate for the EU to seek to take a leading role in global health and in WH reform, given that the bloc is having such difficulties in battling the pandemic? We have large countries in Asia, such as Japan, South Korea, or China, that have been more effective in battling the virus. And then I have a second question on the topic of ICUs. The Commission President announced last night that 220 million euros had been allocated for this. I wanted to know, other than Germany, what other countries have indicated that they're willing to take patients from across borders? Thank you.
Ich beginne vielleicht mal.
Well, perhaps I'll start with the question as to why the European Union should do this. Well, first of all, there is a commitment to international cooperation in the field of health as well. And that commitment to multilateral international commitment takes very different forms in different parts of the world. But as European Union and member states of the European Union, we're very deeply committed to cooperation in international fora, particularly in the field of health as well. That was apparent before the corona epidemic, but I think it's now even more apparent. And so, of course, we need to learn from each other in an exchange of information. We need to learn from other countries who are more successful in combating the pandemic, who have more successful approaches to contribute to the discussion, but at the same time, we need to shape the WHO, and we need to provide it with resources. We need to provide it with information, and we need to exchange views within the WHO regarding these successful approaches. And I think that can serve as a very strong and a very important signal that all 27 EU member states are equally willing to take on a commitment to do just that. It's not that it's the EU on its own in the WHO. The EU can't keep the organization going on its own, as it were, but it is a part of the WHO, because if I look at the WHO resources, the financial resources, and if I look at the level of engagement and commitment, then my feeling is that the European Union, with its member states at the moment, really plays a very key role in this area. It has a very strong role to play.
Thank you, Minister Spahn.
And if I may come in here, because there was a question to myself, but also I just wanted to add to what Minister Spahn said, and really to send the message that the WHO is really what we make of it. It's how we shape it and how we support it and how we use it. So we need to ensure that we have an efficient and a stronger and a transparent WHO, because this is important when we're dealing with global problems. For your second question on how many member states, this is at the moment we're looking at this to see which member states may need help. But as you heard from Minister Spahn, Germany is already reaching out, and I know that other member states already have. Thank you.
Thank you, and apologies, Commissioner Kiriakidis. Do you want to give your statement now, or would you like to, when we wrap up, to give your statement at the end?
I think we're covering a lot that is in my statement in the questions, and I don't want to take up people's time. So let's just go on with the questions. I'm fine. Thank you.
Okay, thank you. So we have two more questions. I see one from Tommaso Gallavotti from ADN Kronos.
Yes, good afternoon. Thank you for taking my question. It's a question for the Commission, for Commissioner Kiriakidis, if I may. Because President von der Leyen, the other day during her press conference, she mentioned the extreme best case scenario as far as vaccines are concerned. I wonder if you can tell us, explain us, which is the worst case scenario. I guess there is a worst case scenario, but if there is a best case, there should be also a worst case scenario as far as vaccines are concerned. Thank you.
So the worst case scenario is that we don't find a safe and effective vaccine. That would be for myself the worst case scenario. And the best case scenario is that clinical trials give the results that we hope that they will give in the next few weeks and early months, and that we will have a safe and available vaccine or vaccines available within 2021. As a Commission, we have been working intensely with the Member States, and I want to thank especially all the Member States and the Presidency for really the support with a European vaccine strategy in order to be able to secure with advanced purchase agreements a wide portfolio of vaccines. We've signed so far 3 contracts, another 3 to 4 are in the pipeline and hopefully will be completed soon. And we're already working with member states with a vaccine for their vaccine strategies, because what we need to understand is that once a vaccine is available, it needs to be deployed, stored, and reach citizens as quickly as possible. And member states need to have both infrastructure and system readiness. And we're already working with member states to make sure that this is in place. Within November, we will be looking back to member states to see how this is moving. So we have said many times that the way out of this pandemic, which will not be a silver bullet, it's not going to end the day we find a safe and effective vaccine. We're going to need to learn to live with measures for a while, but we are doing everything possible as a European Commission with the member states to find a safe and effective vaccine. Thank you.
Thank you.
I just might add what is important for a positive scenario is acceptance by the people. And for that, and I'm very grateful for the approach we have taken together with the Commission. For that, it is important, first of all, to have transparency, and that is what we have, a very transparent way of our strategy and of promoting it. It is very important to make clear that we are actually having several technologies actually we are contracting, so we are not just putting everything on one horse, so to say, in this race. mRNA, vector technology, different kind of approaches, which is important to me. It is important to me that we made clear from the beginning that all 27 member states, no matter how big they are, how small they are, what the GDP is, that all participate and get doses from the very beginning, proportional to the population size. And what I find most important for acceptance, by the way, is that we made clear from the beginning that we will wait for clinical trials phase 3 results before there will be an approval. This will be a vaccine that will be vaccinated 100 million, if not billion, of times worldwide. And for that, it must be sure that it is secure and safe. And that is the European approach we have. And that is very important for acceptance, because there is no sense in having a vaccine that is not accepted broadly by the people.
Thank you very much. I think we're all hoping for that best case scenario to play out soon. So I see one last question from Sophie Petitjean from Agence Europe. Oh, sorry, there's another. Okay. So Sophie?
Yes, hello, Sophie Petitjean, Agence Europe. Can you hear me?
Yes.
Yeah, can you hear me? Yeah, perfect. Thank you very much for this press conference. I'm sorry I missed the beginning, so I hope my question won't be the same as the beginning. So there was an AOB on borders and on free movements. Can you maybe give us a bit more details about what was said and if direction was taken, and also about yesterday's meeting of EU leaders? A question to Madam Commissioner. So you put on the table many documents, strategies, recommendations, and so on. I'm just wondering whether you received any, I don't know, green light on something very concrete or specific regarding your concrete proposal, because it's very broad, and for me it's like everyone is repeating that we need coordination, cooperation, and so on, but concretely, what has changed between, I don't know, the beginning of the week and today after 3 high-level meetings? Thank you.
May I hand over to Commissioner Kiriakidis?
I couldn't hear the question at all. I'm sorry.
Okay, Sophie, can you maybe...
Someone repeat the question to me. I didn't have, it was very interrupted sound.
Sophie, can you maybe repeat your question?
Yes, I hope the sound will be better. So I had 2 questions. The first one was about the AOB and borders, free movement. And my second question was about the reaction the Commission received regarding its proposal, the package which was put on the table on Thursday, I think. So my question was, what has changed between, I don't know, the beginning of the week and today after 3 high-level meetings? Because we are always talking about solidarity and cooperation, but what has changed? I mean, I hope you got the sound this time.
Commissioner, could you hear her? Otherwise, I will just summarize. She asked what has changed after the European Council meeting. Have you gotten anything concrete that you should work on? And the other question was on the AOB on the borders.
Well, first of all, the council meeting was yesterday evening. We've already are taking forward a number of the suggestions that have come out from the council meeting. I think the important message here was that there was agreed on the need for solidarity, coordination, cooperation at many different levels, including the issues to do with the need to share data information with ECDC, the need for testing strategies, the discussion on rapid antigen testing. May I remind you that we have been working with this very, very closely, and we're currently working on a joint procurement as well for rapid antigen tests. I think the first question was on board. I didn't hear it, but I think it was on borders. We have put forward the importance of coordinating our approaches to travel restrictions. This is crucial for our citizens, and we need to move with this as quickly as possible. We adopted a color-coded system about 2 weeks ago. This now needs to be implemented, and we're looking at other ways in which we can move forward. Thank you. I couldn't hear it.
Thank you, Commissioner. There's one last question from Thomas Gutschka from FAZ.
Ja, vielen Dank.
Yes, thank you. We have interpretation from German, so I'm going to put my question to Health Minister Spahn in German. Minister, if I'm not much mistaken, in February you were strongly advocating the idea of uniform forms to trace travels abroad. It applied to flights in particular. And now, as things stand, the European Union is still working towards a uniform passenger locator form, but it's the end of October and we still don't have one. Why is it so difficult? Why isn't it possible to take what is in fact a relatively simple task and get it done within the space of a few weeks? Because more than 6 months have elapsed already. Thank you. Well, if I could reply directly on, well, first of all, what we've said still stands. The European Union can only be as good as its member states allow it to be. And in the course of the German Council presidency, we've experienced just how challenging it is to ensure that all 27 member states can sign up to a common framework when it comes to travel and testing in relation to travel outside the European Union, and determining and defining risk areas and quarantine rules. So if you're asking why it needs rather more time, well, it needs time to get all 27 member states on the same page, as it were, and there were also some technical challenges which we could comment on in more detail, because at least in Germany, in November, we will last be making a start on a digital entry system for travellers, and we've been working on this, and other countries already have this sort of thing as well, but we've made fairly good progress, and I know what a huge technical challenge this has been in Germany, and it certainly is at European level as well. But I would agree with you that the sooner the better, I would say.
Okay, Commissioner Kiriakidis, do you want to add to this?
If I could add to that, we have 11 member states so far with a digital format. There have been many important questions which have had to be dealt with. It's not such a simple exercise, as Minister Spahn have said, to do with data protection, etc. And we're holding a pilot within November, and we hope that the European system will be, the European-wide system will be available at the end of this year. All the member states have showed an interest in joining this, and we hope to be holding a pilot of this within the next few weeks. Thank you.
Thank you, Commissioner. I just want to see if there are any final remarks from the Minister or the Commissioner before we end the session.
No.
If I may, just one or two final remarks, because I think it is important that we highlight some of the areas. First of all, at the Special European Council yesterday, President von der Leyen presented additional measures that need to be taken by member states in order to have this better coordination, cooperation and solidarity for travel and for everything else. And this is why we highlighted as well a strategy on testing and the rapid use of antigen tests, which we'll be coming forward with as soon as possible. But testing alone is, as I said, not enough. We need to have reliable data and smooth information flows so as to be able to make correct decisions. And this is also impacts on having a common approach on travel. So I therefore urged again ministers to provide ECDC with the speedy and accurate information of their epidemiological situation. This better coordination will bring, as Minister Spahn said, more trust and more predictability. And this is something we need to build upon. Having a vaccine itself is not going to solve the problem. Vaccination is going to solve the problem. So we need to have this level of transparency and to really send the message that we are not going to lower the bar in terms of safety for a vaccine. And finally, I just wanted to highlight that on the 11th of November, we will be presenting our first step towards a European Health Union, presenting with stronger mandates for ECDC and the European Medicines Agency in order to improve their crisis response capacity. And this I think is out of crisis as this one also come opportunities, and this is the start of a process for a more secure, a more prepared, a better prepared and a more resilient EU that really does do what citizens expect of us, to protect their health. So with that, I thank you for your attention, and I apologize about the technical difficulties, but this comes with teleworking. Thank you.
If you allow, now I would dare to just add that under the German presidency, we want to take up, of course, then as soon as possible and as quick as possible the proposals by the Commission that were just announced by Commissioner Kyriakidis for the 11th of November. We want to start then to discuss it within the Council on all levels and to find a position on that as soon as possible, especially regarding legislative proposals that be there for the ECDC or the EMA mandate, so that actually conclusions can be taken as soon as possible. By the way, EU for Health, we have found already a council conclusion on the EU for Health, and now we want to start the trilogue as soon as possible. The Parliament will vote on its position very soon, and then we want to finish the trilogue within this year, because it is important for all member states and the European Union that EU for Health will be starting 2021.
Thank you very much for these very interesting final remarks. So thank you to the Minister, thank you to the Commissioner, thank you to the interpreters as well. Thank you for this, and have a very nice weekend.